My name is Sharice Dominguez, and this is Chris Dominguez, and I will be um, recording a skills video of the head-to-toe assessment through Nightingale College. Chris Dominguez, do you have consent to participate in this skill video and be recorded?
Yes, I do.
I will go ahead and get started. So I'm going to enter the room, close the door, pull the curtain for patient privacy. I'm going to do hand hygiene, and I'm going to go ahead and put gloves on. And then I'm going to introduce myself to the patient. Hi, my name is Sharice, and I'll be your nurse today.
Nice to meet you.
I'll be performing the head-to-toe assessment on you today because you recently had a tonsillectomy surgery.
Okay.
It will be head-to-toe. I'm doing this because since of your recent surgery, I'm making sure that all your systems are back to normal.
Okay.
Can I see your wrist or your wristband?
Okay.
And what is your date of birth?
August 18th, 1971.
And your name?
Christopher Dominguez.
Okay, very good. So, do you know what time of day it is? Morning, afternoon, or evening?
It is afternoon.
Do you know what day of the week it is?
It is Saturday.
And do you know what month it is?
It is July.
Okay, and do you know where you are?
I'm in the hospital.
Okay, patient is oriented times 3. So I will go ahead, I already took the vital signs. Vital signs are temperature 98.6, blood pressure 120/80, heart rate is 75, respiratory rate is 16. Um, are you having any pain right now?
No.
A patient denies pain. So I will go ahead and get started. Is it okay if I touch you?
Yes.
Okay, I'm going to start with your head. The patient has no abnormalities, lesions, abrasions. Um, the hair isn't thinning and there's no bald spots noted. I'm going to move down to your eyes. If you could remove your glasses, please. I'm going to look. Eyes are symmetrical. I'm going to lift your eyelid and your lower eyelid. Sclera is white and conjunctiva is pink and moist. Okay, I'm going to look at your eyes.
Okay.
Just look straight for me. Okay. Pupils are round and reactive to light and accommodation. I'm going to go ahead and look at your ears now. You can move your head. Okay. There's no, ears are intact. There's no drainage or discharge. Same thing with the other ear. There's no drainage or discharge. Intact. The ear's intact. I'm going to go ahead and whisper some things, and you tell me what you hear.
Okay. 1, 2.
Yes. Patient's hearing is intact. I'm going to go ahead and look at your nose. If you can go ahead. Okay. Patient's nares are moist and pink. No lesions or abnormalities. The septum is midline, no deviation noted. I'm going to go ahead and palpate your sinuses. No swelling or tenderness noted. The lips are pink. No cracks. Open your mouth. Okay. Patient's mucosa is pink and moist. Teeth are intact. No tonsils noticed due to the recent tonsillectomy, and there's white patches in the back of the throat. Okay. I am going to move down to your neck. some light palpitations. Lymph nodes are, there's no swelling. Um, there's no tenderness. Trachea is midline. There's no jugular distension. Um, can you move your neck forward, back, side, and to the other side? Patient has full range of motion of neck. Okay. Now, um, I'm also going to test your sense of smell.
Okay.
Can you close your eyes? What do you smell?
Sanitizer.
Okay. Patient's sense of smell is intact. So I'm going to move down to your respiratory. So I'm going to listen to your lungs. Are you able to sit up and move over to the side?
Yes.
All right, just breathe in and out. Okay, do the same thing on the back. Okay, you can sit back down.
Okay.
Lay back down. Okay, patient's lung sounds are clear in all lobes. No adventitious sounds noted. Um, patient's chest falls up and down symmetrically. There's no labored breathing, no accessory muscles used. Um, I'm going to move to your cardiovascular, so I'm going to listen to your heart.
Okay.
Just breathe normally. All right, patient's heart sounds are normal rate and rhythm, S1 and S2 heard. Um, I am going to check your pulses. So patient's radial pulse is +2 bilaterally. I'm going to check your feet.
Okay.
Patient's dorsalis pedis pulses are +2 bilaterally. And I'm going to see your hands again. I'm going to gently press down on your fingertip. Okay, patient's upper extremity capillary refill is less than 3 seconds. I'm going to do the same thing on your toe.
Okay.
Patient's lower extremity capillary refill is less than 3 seconds. And then I'm going to draw your hand again. Skin turgor has no tinting, meaning good hydration. And now I'm going to move on to your abdominal area.
Okay.
Are you having any issues with urination or bowel movement?
No.
Okay. When was your last bowel movement?
Early this morning.
Okay, good. I'm going to listen to your bowel sound.
Okay.
Just breathe normally. Okay, patient's bowel sounds are active in all 4 quadrants. I'm going to palpate. You let me know if there's any pain.
Okay.
Is there any pain?
No.
Okay. Um, so now I'm going to move to your neural system. Is there any joint pain you're having?
No.
No. Okay. I am going to assess your dull and sharp pain. So this is dull and this is sharp.
Okay.
So I'm going to test it on your arms and legs, and you just identify which one.
Okay.
So go ahead and close your eyes.
Dull. Sharp. Sharp. Dull. Sharp. Dull. Sharp. Dull. Sharp.
Patient is able to identify sharp and dull pain. His senses are intact. Um, so now I'm going to assess your strength. If you can come out and sit again. Okay. So I'm going to put your hands here. Try to, okay, good. Now put your arms out. Don't let me push you away. Okay. Patient has good strength in shoulders and arms. Let me see your hands. Squeeze. Okay, patient has good strength in hands. Are you able to do this? This? Okay, patient has range of motion in arms. You put both your legs up and don't. I'm going to push down and don't let me. Okay. Now, can you move your legs up? The other one. Now, can you do this? Do this? Okay. Um, Patient has good strength in legs. Can you stand up for me? Go ahead and walk back. Okay. Let's go and have a seat. Patient gait. Okay. So that concludes my head-to-toe assessment. I'm just going to provide some education. Also, if I was to evaluate this patient for the Glasgow Coma scale, it would be 15 because he's able to look at me, speak to me, and follow directions. So, since you had a recent tonsillectomy, when you go home, make sure to consume only cold things like ice water, ice cream, yogurt. Stay away from hot foods or beverages because it's going to be really painful.
Okay.
You can have lukewarm if you can tolerate it. And also, your throat's going to have white patches on it for a while, so don't freak out.
Okay.
All right, so you have any questions for me?
No, that's done. Thank you.
Okay, I'm going to remove my gloves, put them in the trash, do hand hygiene, and then document all my findings, and then I'm going to leave the room, close the door for patient privacy. All right, thank you.